I became ill since I was like 12 years old. So it was really, really difficult at school. I was diagnosed at 17, 18. My dad took me to sort of witch doctors and all that first of all. And then we went to a psychologist. She referred me, told me, that was private, she referred me to a psychiatrist, private, and then they referred me to Tower Hamlets, NHS. I was diagnosed with bipolar. I have bipolar type 2, which is the more lows are really bad. I get highs, but they're not, in my 20s they used to be pretty bad, but they've sort of come down. I didn't know anybody that had bipolar, depression, anxiety at all, so it was really difficult. At 12 you don't know how you feel. You don't know that you just feel sad, but when people ask you that, what is it, what's happened, as your dog died, is somebody bullying you? No, you can't say I'm sad because I don't know why I'm sad, I don't know why I'm low. So that was difficult, but then I sort of kind of got higher, and those periods where I could cope, they were happy times. But then I got low and it was really hard to push myself to go to school. I didn't sort of come off of school because of it, because I thought that if I get behind with homework, it would worry me more. So I pushed myself to go in all the time. But yeah, it was difficult. And then when I was diagnosed, I have attempted suicide a couple of times. I ended up in the hospital one time. That was sort of 19, 20 years old. And when I got ill, it was such a long time ago, and there wasn't any mentors and somebody to talk to at school. That would be, I think there are mentors, I know there are mentors now to recognise the person, but it's so hard, it's so hard to go and get help, to ask for help, because you don't know what you're feeling. If you kind of hear voices, what are you going to say? You really feel scared, you think, no, but you're the only person that feels like that. So I couldn't say anything. But maybe today, if somebody, a professional recognises people like that and recognises that it's not something going in the home and they can get the family together, that would be a really good thing for that. Involve the family instead of just the person and thinking that person is doing something wrong, is playing up at school. It's because of that. I've got a son, he's 15, and before that I've kind of worked on and off. I've come off of work because of the depression and anxiety, because I really can't cope. I can't go in, because I can't come out. I'm paranoid, anxious, and it's really difficult to concentrate, so I couldn't do it. So I'd come off work, and then when I got better, I'd not go back to the same job. I'd go and get somebody else. I have only got a psychiatrist at the moment. I used to have CPNs, and that finished because I get better, but I'd need somebody when I'm worse. But my psychiatrist is fantastic. We have a really good relationship with each other. I always see that psychiatrist all the time. I don't see an understudy, so that works, because seeing an understudy, they don't know you. They can't, they can't talk to you like the other person, and it's just different, because I did used to have different people, psychiatrists, understudies, and I hated it. You become a number, you go in, you come out, and you don't have that relationship with the psychiatrist. You need to do that. You really need to do that. My GP before is changed into a walk-in centre now, but yeah, they've been very good. They can't, because it's the tablets are, mental health. They can't really prescribe, or because they know that I'm with a psychiatrist, they can't really prescribe this drug, that drug. And I mean, the last time I went, she says, well, you know, see what the psychiatrist says and go with that, you know, because she doesn't want to sort of change my tablets. But I do go to my psychiatrist. Yeah. I've never gone really to my GP with mental health. If it's physical, I'll go. If it's not, I've got a psychiatrist, so you know, I'll go there. It just makes sense to go there. Communication between the receptionists and myself, because I've recently, before it used to be better in that way. Since they've moved to Three Colts Lane, it's been worse. Before that, you know, the receptionist was friendly, she'd been there a long time. The appointments were fast because the psychiatrist writes a letter, copies it to the GP and copies it to myself. At this time, I'm getting the letters late. When I go back to the psychiatrist, I haven't got that letter that comes to me and then goes to the GP. So it's worse in that way, the communication. And getting an appointment, they don't phone you back. You have to phone them back again. And then when you're really, you know, depressed and anxious, it's really difficult to pick up the phone and even talk to somebody and ask for an appointment. Because I'm around a lot of people that have mental health issues, the volunteering that I do is good for me. Because I've got a lot of insight into my depression, my illness, I feel that I can sort of help others and be on the same sort of level with them and have empathy. I kind of think that's the help that I would have liked in the past, and I never got it, kind of thing, because nobody ever befriended me. The healthcare professionals and I mean, not my psychiatrist because he's brilliant, but they should listen to us. This is a really good thing that we're doing, that you're doing, that they can sort of listen to. They are listening. Well, hopefully they're listening to us and they give us feedback on this, because that's what we need. Because otherwise we do this and it goes away and it's lost, and you know, we don't know anything. So that's, you know, you need feedback.
Well, I'm 37. I've been in psychiatric hospital 10 times. I've been sectioned twice. I was last October for 4 weeks. My psychological health at present, I'm a bit up and down. I see a psychologist at Stepney and Wapping Community Mental Health Team, because sometimes you can feel really low, and sometimes you don't know why and things like that, you know. That's definitely a difficult thing to deal with. Or being manic, you know. Yeah, sometimes you can't control it. If you go manic, you go totally out of control. You know, I mean, I've been sectioned twice because of that. Definitely the psychologist at the community mental health team is very good. The community psychiatric nurse I see, my psychiatrist, Dr. Dudley Manns, he's very good. When I was admitted last October, I went to the A&E and it was a lot quicker than usual, so that helped as well. Not all the waiting around and that you normally get. And yeah, I was in the hospital for 4 weeks. Before I went in, I'd thrown my shoes away and that was quite delusional and that. And when I went in, it was 5 or 6 days in bare feet and that, you know, and 5 or 6 days without toothbrush and toothpaste. So you could definitely, because the hospital didn't have any, you know, anything to wear on your feet and stuff like that. So I ended up getting athlete's foot and stuff like that, you know. The office used to be this side of the corridor, and it'd be ages before it was answered, but they moved it to that side and it was answered virtually straight away. So that was really helpful, you know, because if you're knocking for ages, you get dead frustrated. Because if they're doing one-to-one on someone, they don't talk to them. You just sit there and look at them, you know, and that can make you feel uneasy. they'll be sat and watching you because you might be suicidal or something like that. And I think it'd be better to speak to them, you know. Well, definitely there's been improvements, but there's still, you know, work that needs to be done, definitely.